Hi, my name is Alicia Markham, and I would like to talk to you about systems theory. Systems theory is an approach to understanding complex systems. It suggests that behavior is influenced by a multitude of factors, and it helps us understand how those different systems interact and work together. It's all about big picture thinking and looking at the patient holistically, taking into account all of the things that make them who they are. It helps the clinician to better understand the reasons behind their patient's struggles, allowing them to look at all factors of the patient's life. In the book Systems Theory in Action, the author lays out 7 concepts to help us understand systems theory. The first concept is context, which suggests we need to alter our perceptions. In order to truly understand an individual, we need to take in all contextual variables into context, such as culture, religion, education, and economics, just to name a few. This concept allows us to challenge what we see and dig a little deeper to what is really going on underneath. The second concept is causality, which addresses our need to know why. It's about not relying on a cause and effect model. We often want something or someone to blame. Systems theory encourages us to look more at a circular pattern rather than pointing fingers at just one thing, and understand that there are more than often multiple reasons for a person's struggles or difficulties. The third concept is communication. Systems theory helps us analyze problematic communication. We can dig a little deeper and see what is not being said, or perhaps what the patient meant to say. We can understand their intent and help establish more productive communication. The fourth concept is change. Systems theory allows us a more balanced look at change, and it helps us understand the relationship between change and acceptance. Before meaningful change can happen, there is often a moment of truth, an acceptance of reality. Change begins after accepting what is without denial. The fifth concept is structure, and it helps us break down our belief that there are hierarchies in families and universal family structures. It also helps us understand power and privilege. Who raised the patient and how did that affect them? The sixth concept is history and development. Systems theory utilizes a multi-generational approach and helps us understand that we often repeat what we are taught. If we can recognize that we are repeating harmful behaviors that have been passed down to us, then we can work to change them. Finally, the seventh concept is social and cultural narratives, which suggests we believe the things we tell ourselves and that our differences are hardwired. This allows us to help patients identify their core beliefs and change their irrational thoughts to rational ones, which in turn changes their emotions to more positive ones. Understanding systems theory is crucial for people in social services to be effective. All in all, it will help us to recognize the bigger picture and treat the patients as a whole and individually, and not just structure our treatment plans to helping one person. It helps us individualize these things. Social service workers can employ systems theory to better understand their patient's personality and choices and what shapes their identity. It will be extremely useful in approaching things like child abuse, family conflict, and community dysfunction. As an addictions counselor, this theory will be helpful to me because it will allow me to look at what is really going on that led my patient to treatment. I will be able to help them identify how things such as their family dynamics and social networks contributed to their addiction. Did they grow up in poverty? Were they abused? What are their core beliefs and what are they really trying to say? Are they in denial or on their way to accepting that they have a disease? By utilizing the third concept of communication and truly listening to what they are intending to say, I can identify their motivation for change and help them navigate successfully through the recovery process. This is a concept I have noticed that I lean on a lot, both the concept of communication and the next one of change. I have noticed myself being able to recognize when patients share things with me or in group. I can see the things that they are not saying, or perhaps things that they are not able to see. A lot of patients believe that they are at the point of accepting their disease, but in all actuality, I can hear a lot of resistance. They say they are willing to do whatever it takes, but they are not going to in-person meetings or have not found a sponsor, just as an example. I can utilize systems theory with these patients to discover what is holding them back to fully working a program. Is there something in their personal beliefs holding them back from the spiritual part of the program? By looking at all aspects of their personal system, I can help them address this. Also, by utilizing this theory, we can work together to ensure the things that contributed to their addiction do not continue to sustain it. For example, do they need help finding a job or a more suitable place to live? I also think systems theory will be particularly useful in helping the patient alleviate shame. Systems theory can help them understand that there are often various influences that made them vulnerable to addiction. Often, patients who come to treatment are full of blame and cannot separate themselves from their disease. Talking to them about this theory can help them see that there is a whole system at play, and hopefully they can begin to stop blaming themselves. Systems theory will also play an influential role in developing effective treatment plans for my patients. By examining them as a whole and looking at all of the systems that affected them, I can decide on certain things such as whether or not to include their family in their care. Perhaps their family enabled their addiction, or there is a certain level of codependency going on. Maybe I need to work with them in developing boundaries or addressing some sort of power struggle that may be going on. Or, on the other hand, perhaps they have a very supportive family and it will actually benefit them to have their family included in their care. Or maybe I will need to collaborate with other professionals. Is there a co-occurring disorder at play? Do I need to send them for a more in-depth mental health assessment? Or do they identify with a particular culture where they might benefit from seeing a spiritual healer? Or do I need to incorporate more meditation, physical exercise, or maybe nutrition education into their treatment plan? By looking at the whole picture, I can treat the patient more holistically and not rely on a one-size-fits-all approach. I found myself already utilizing this in my position as a case manager at a recovery center. It has allowed me to treat each patient individually. I actually tailor and structure treatment plans based on what each individual patient needs. I give them homework assignments to address their own unique concerns and situations. For example, I recently had a patient whose economic and financial problems contributed to their addiction, so I am helping them develop a budget, which in turn will hopefully prevent relapse. Another example is a patient whose living situation was problematic. So I recommended they enter an Oxford house, and I am assisting them in their search to find one that is LGBTQ plus friendly. In conclusion, systems theory allows social service workers to shift their lens from looking at not what is wrong with a person, but what is going on in the entire system that they are a part of. Thank you.